Children can take medications through their feeding tubes. It is best to get these medicines in liquid form, if possible. However, some drugs are only available as tablets or capsules. These medicines will need to be crushed or mixed with water so you can give them through a feeding tube. It is important, though, to always check with your doctor or pharmacist before doing this, as there are some medications that should not be crushed. The following will provide you with general information about giving medications to your child through his or her tube. We will also demonstrate how to prepare and administer liquids, tablets, and capsule medicines.
Here are some general guidelines when giving your child a medication through his feeding tube. Always start by washing your hands. Also, always double-check the medication container to make sure you are giving the right drug at the right time and at the correct dosage. Do not add any medication directly to your child's formula. The formula may react with the drugs, become lumpy, and clog the feeding tube. Do not mix medicines together before putting them in your child's tube. Instead, give each medicine separately. Try to give your child medicines throughout the day instead of all at once. Always use a clean syringe and equipment for each medication. You may also need a measuring spoon or cup, a mortar and pestle, pill crusher, or 2 spoons, as well as some warm water to dissolve powders, tablets, or capsules. You will now have to check the placement of your child's feeding tube. If your child has a button or low-profile tube, attach the straight extension tubing. Before giving the medication, always flush the tubing with lukewarm water. If a feeding is in progress, stop it and then flush the tube. Use the amount of water recommended by your doctor or nurse. After the medication has been given, flush the tube with lukewarm water again, using the amount recommended by your doctor or nurse. Generally, you can restart the feeding within 30 minutes after all medications have been given. However, check with your doctor or pharmacist to make sure. You should follow all of the steps for each medication you give. Also remember to flush the tubing between each medication. Check with your doctor or pharmacist to find out if the feedings need to be held for a longer period of time after taking specific medications, and if any medications need to be given on a full or empty stomach. If your child has a J-tube, also talk with your doctor or pharmacist, as some medications may not work properly if they do not go into the stomach.
When giving any medication to your child through his or her feeding tube, it is important to follow all of the steps we discussed in the previous module. If you are not sure about something, take the time to review that module.
Please refer to your Home Tube Feeding for Children guide for details. Liquid medications are easy to deliver through a feeding tube. Check with your pharmacist to see if any of the medicines your child needs are available in liquid form. The pharmacist can also provide you with syringes. Liquid medications need to be accurately measured using a syringe or measuring spoon or cup. Draw up the exact amount of liquid medicine prescribed into a syringe by pulling back on the plunger. Check it against the dose on the bottle. Label the syringe with the name of the medicine if you are giving more than one drug. You will want to give the thinner liquid medications first and the thicker ones last. After assuring placement of the feeding tube or attaching the bolus extension tubing, flush the tube, administer the liquid medication using a syringe, and flush the tube again. Repeat as necessary. Tablet and capsule medications are not difficult to deliver through a feeding tube. Tablet medications need to be crushed. It's easiest to do this with a pill crusher or mortar and pestle. both of which you can get at the pharmacy. You can also use 2 spoons to crush the pill into a fine powder. Once the tablet is crushed, dissolve it in about a tablespoon or 15 milliliters of warm water. When giving a medication that is in capsule form, it's important to remember that the beads cannot be crushed. Instead, you will need to open the capsule and dissolve its contents in about 1 tablespoon or 15 milliliters of warm water. Once it is completely dissolved, draw it up into a syringe. After assuring placement of an NG tube or attaching the bolus extension tubing, flush the tube. Administer the liquefied tablet or capsule using a syringe, and flush the tube again. Repeat as necessary, remembering to flush the tube between medications.